So we're going to talk about a Morton's neuroma today. Now, what is a Morton's neuroma? It's typically a swelling around the nerve fiber or the nerve sheath that's in the foot. Now, imagine my hand as your foot. You're going to see your big toe here, and you're also going to see your pinky toe on this side. Where we tend to see a Morton's neuroma occur is between the third and fourth digit. So you're going to kind of see it sitting right here between the bones themselves. Now, most of the time, the pain will start at the base of the toes. And if it gets bad enough, it'll tend to kind of radiate into the toes themselves. We're also going to kind of experience this with people that wear tight shoes. So high heels, really constricting shoes, or someone that might kind of require a flex position of their toes will put a little stress on this nerve as well. Now, about 10% of the population will experience this in their lifetime. Majority of the time, it might be female. And I think that correlates, again, with the high heel shoes, the constricted shoes, because society tends to kind of move towards the side of constrictive and pointy shoes. So typically what we'll see in the office when a patient comes in with this condition is, like I mentioned earlier, we're going to see that sharp and stabbing pain kind of right at the base of the toes, and it's going to sometimes radiate into the toes themselves. People describe this as they kind of feel like they're walking on a marble. So every time you take a step, it kind of just stabs and you have that kind of dull, achy pain in the foot. Now, you'll also see this pretty common when you're wearing really tight shoes. So the patient may take off their shoe and kind of massage the area, and the pain will go away. And that's very common as well. Now, we are also going to see kind of a biomechanical shift in the ankle as well as the foot, maybe a little bit into the knee, because like I mentioned earlier, you're stepping on a marble each time you walk. So you're going to shift your weight and kind of how you walk. And that might help alleviate some of the discomfort in the foot. So how we typically treat this in the office is we have to give you a little bit of education. We have to teach you how to, one, mobilize and kind of stretch out that area. Two, we might have to modify what we're wearing day to day shoe-wise, because we have to give the toes some space to kind of reduce some of that swelling and inflammation in that area. We also might have to work a little bit on stretching out some of the muscle tissue that moves into the foot. So you're going to see the calf muscles. You're going to see some of the muscles that control the foot and movement. You're going to see all that myofascial release techniques to be done in here for this condition. Now, we also might see a good nerve mobilization or a nerve floss exercise help this as well. Because if we can kind of get that nerve to move back and forth, it might help kind of break down some of the constriction that might be occurring that could be creating this problem. Now, you're also going to see that if we do fail with conservative care, which sometimes might have to occur, an injection tends to be really useful for this condition, and it's very positive when we do get an injection for something like this. So that's what kind of the research is kind of pointing to, is we trial a conservative care. If it doesn't work, we'll push you a little bit more to an injection. So if you yourself or you know someone that might be dealing with foot pain that kind of sounds similar to Morton's neuroma, we'd love to take a look, examine it, kind of give you our little feedback, and just kind of see if we can help out in any way. So don't be afraid. Give the office a call at 513-463-3011, and we will see you soon. Thanks.